by Tanya Rose, who will take us through her particular experience of COVID and the Support at Home COVID Positive Pathways program, which will have more to say, and her recovery from earlier this year. But first, just an update on all the various numbers associated with the current pandemic arrangements. So in regards to vaccinations, there were 27,908 doses of COVID-19 vaccine delivered at our state-run clinics on day 4 of the walk-up blitz. That now constitutes a total number of 32.6% of Victorians aged 18 and over who have had their 3 doses. We've now hit 4 million people who are eligible for their 3rd dose, having brought that date forward to that 3-month period last week. And of those 4 million, 1.7 million Victorians have stepped forward to get that 3rd dose, and we thank them very much. But what it does point to is there's still a lot of people out there who need to come forward and get that 3rd dose. That 3rd dose that keeps them protected, their families and their community. We also saw 4,347 children get their 1st dose through the state-run clinics yesterday, and 123,933 children in that age group of 5 to 11 have now received a paediatric dose across the state. That's some 32% of the total age group in that 5 to 11-year-old bracket, and that's up from 30% from yesterday. So really strong numbers in all those categories. Shows that Victorians are continuing to come forward in really strong numbers, whether it's through the state clinics, through primary care and GPs or pharmacies. Please come forward and get either that 3rd booster dose, or indeed the families and carers continuing to support the 5 to 11-year-olds in such strong numbers for their 1st dose. Amongst people with COVID-19, yesterday we saw 1,057 people in hospital. That is up slightly from the figure of 998 from yesterday. That's a 7-day running average of 1,063. 119 Victorians are currently in the intensive care unit. That's pretty stable from the same figure yesterday. And we've seen a very small drop of people on a ventilator in ICU, down from 47 to 45. Tragically, we saw some 29 people with COVID pass away, 12 of whom have died within the previous 2 days. And if I can take this opportunity to pass on our condolences, best wishes and thoughts to 29 families who have lost a loved one, 29 families who will be mourning and grieving that sad loss at this time. 8,539 people reported their positive COVID-19 status through the rapid antigen test coronavirus self-reporting program yesterday, and a further 6,297 Victorians received their positive confirmation through the PCR testing system. That's a total new case tally of 14,836, and there are a total number of active cases across Victoria of 183,154 people. 30,726 PCR tests were processed, and over 30,000 rapid antigen tests were handed out across Victoria's 70 testing sites yesterday. The most important thing we can do is to get those 3rd booster doses and those paediatric vaccines into the arms of Victorians in the very strong numbers. There are currently 236,000 vaccine bookings available through the state system over the next 30 days, and there's 69,000 of those are aged for children 5 to 11. So please, there are plenty of opportunities. Come forward, make that important vaccination appointment, make yourself safe, your family safe and your community safe through that important vaccination program. 19,500 children aged 5 to 11 have been booked in over the last 7 days for their first dose, and we're now taking, of course, the second doses bookings, and we've seen some 4,500 of the second doses with the 8-week interval for paediatric doses in the system. So first or second doses for the 5 to 11-year-olds are in the system. Please come forward and take advantage of those. Our major iconic site, the Royal Exhibition Buildings, opens today for child vaccinations, and I can report 1,653 vaccination appointments are available over the next week at the Royal Exhibition Buildings, which has also been kitted out in the Enchanted Forest of Protection theme. Parents wanting to know where to book, there are plenty of opportunities for kids' vaccinations right across the system over the next week, be it at the Royal Exhibition Buildings, be it at the Sandown Racecourse, the Cranbourne Turf Club, the Ford Factory at Camberfield, the Shepparton Showgrounds, the Geelong Ford Factory and many other sites right across our system. Not to mention the fact that the majority of 5 to 11-year-old vaccinations continue to be delivered by our partners in GPs and pharmacies, and I would encourage families and carers who are yet to do so to come forward and get those vaccines rolling so kids can get back to school as safely and as quickly as possible. In regards to the 4-day blitz on vaccinations that wound up, it was a strong success. We saw between Friday and Monday over 104,000, almost 104,000 and a half Victorians got their vaccine through those state-run centres. From that period, from the same period of the previous week, that was compared to 75,000, a 38% increase week on week is a really significant achievement. Shows that when we put the effort in, we can continue to do that. The Royal Exhibition Buildings had its busiest week in the life of the vaccination program so far, with almost 3,500 doses administered on Sunday alone. That's twice the number of doses that were delivered across the entire state-run system when the system cranked up again some 7 weeks ago. The Royal Exhibition Buildings also, with its extended hours, reported a bit of a spike as the tennis wound up on each of the various nights of the tennis program changing sessions. We've also got, we also delivered over 1,300 doses at Frankston, 900 doses delivered on each day of the weekend at La Trobe University, and Dandenong Plaza had its busiest weekend of more than double its usual numbers. The Blitz was done in partnership with a number of primary care providers, and I'll particularly thank the thousands of doses, extra doses that were rolled out by some of our GP partners, most notably Dr. Mukesh Harkawal and Dr. Shay Willocks in the western and northern suburbs, who are doing an extraordinary job in working with their communities. We provided those clinics with over 900 extra doses, and they delivered close to 1,000 extra doses above their already substantial programs over the course of those 4 days. In regards to what we want to focus on in our comments today, and I'll get Adam and Tanya to talk about this in more detail, is we just want to make it clear to Victorians that there are a range of tools and opportunities to help people to safely recover and make their way through the COVID journey. For every person who ends up in hospital, and then there are a significant amount of Victorians in hospital with COVID, thousands more get mild symptoms and are able to rest and recover at home, and that's the best place to be with the support that you need if you are in that category. And whilst symptoms can and do vary, and people should of course seek care if their condition worsens, we know that there are more than 550,000 cases of the virus this year alone, and of those 550,000, 0.71% of people have needed hospitalisation. So not even 0.75% have needed to be hospitalised. So the amount of support at home to get safely through the COVID pathway is critical. And that's all about the best model of care and support, but it's also about keeping the pressure off our doctors, our nurses, and our paramedics. So that's why today we're launching a campaign to show people that the resources that are available for them and the best way in which to get in touch and get that support that you need. The program is called the Get the Right Help for Your Recovery campaign, and it will support people experiencing mild symptoms by providing them the support and education they need on measures such as how to rest, how to keep up hydration, and how to deal with pain relief so that they can feel confident and secure in managing their pathway to recovery at home, knowing that if they need it, the support is there and is available either digitally at the phone call or if their situation worsens through the healthcare system. This campaign will run across all platforms: TV, radio, social media, print, outdoor media and digital, and it serves to remind us to keep the 000 calls for emergencies so hospitals can help Victoria's sickest patients. Still, we're getting reports from Esther that 1 in 5 emergency calls to the 000 line are not emergency calls at all, and we would encourage people to keep 000 for the most serious of matters. But for those who are experiencing severe symptoms, the campaign explains what signs to look for, what to do if you do need additional help, such as speaking to your GP, your pharmacist, the nurse on call system, or the National Coronavirus Hotline, which of course can be reached on 1800 020 080. That's 1800 020 080. The program is also designed to put people in contact with our COVID Positive Pathways program, which has helped more than 500,000 people since it was launched in October last year. And Tanya, as a participant in that program, will talk to her experience as to how her and, like we say, 500,000 other Victorians have got through that system. This seeks to put people who are positive cases in touch with the assessment for the support they need, the risk assessments that accompany that, the monitoring of their position, and to the provision of information so how they can deal with their recovery and, should they need it, connecting them rapidly with the support, the reassurance of both clinical and social needs that they might need to get through their COVID program. In some cases, that might mean getting the support for the right clinical, if not emergency, support, or it might be dealing with accommodation issues about how to safely isolate, or it might be the mental health supports that people might need. It could be issues around food relief, support for family members, how to deal with family violence issues, alcohol and other drug supports, the whole range of the complexities that life in 2022 brings, but which do not go away if you return a COVID positive result, need that support to get through that period of isolation and recovery, is what the COVID Positive Pathways program is all about. It's there to make the program of your recovery easier, to provide the support and confidence that you can recover safely at home, and to take the pressure, as we say, off our paramedics, our hospital system, our emergency department and our healthcare professionals. It's something that we urge all Victorians who do test positive to take advantage of, and I'll hand over to Adam Horsburgh, the Deputy State Controller of Health, to talk about it in more detail, and then perhaps most importantly Ms Tanya Rose to discuss her particular journey through that system. Adam.
Thank you, Minister, and good morning. I'm delighted to be part of today's launch of the new advertising campaign, which will form such an important part of our ongoing response to the pandemic and really help to ensure that we're keeping all Victorians safe. In my role, I hear firsthand many of the stories of people who have felt the need to attend an emergency department or call 000 because they didn't necessarily know how else to access the advice or support that they needed when they tested positive. As we've outlined before, it is vitally important that we work to relieve some of the pressure that our frontline doctors and nurses are facing. And that's why we need to provide Victorians with the ability to both recognise and safely manage mild symptoms of COVID at home. In that context, our COVID Positive Pathways programme is a really important element of our ongoing response to the pandemic. And the programme itself is a great example of how our hospitals are working in partnership with primary care and community health to support Victorians to take direct control of their own health. In practical terms, everyone who tests positive or registers a positive rapid test will receive a text message that includes a few short questions. And we would encourage all Victorians who receive that message to please respond to those questions. As the Minister has outlined, the majority of people are then assessed as being able to self-manage or requiring only minimal intervention. Of the 74,000 people that we currently have enrolled on the Pathways programme, about 3/4 are assessed as being low risk, about 1/4 as being medium risk, and around 1% as being high risk or requiring hospital level care. But the important thing is that everyone on the Pathways programme is able to monitor their symptoms using the app and are guided to seek further advice or support, be that through their GP, a pharmacist, the National COVID hotline, or they may receive a proactive call from one of the programme nurses. One of the other great features of the programme that I know Tanya will speak about in a moment is the other services that individuals can be linked into based on need. These other services include emergency accommodation, food relief, or support to access mental health and drug and alcohol services. Just before I hand over to Tanya, I wanted to give a brief update on what has happened since we announced the coordinated pandemic code brown last week. All Metro health services and the 6 large regional health services are now operating their code brown response. In addition to that, a small number of rural health services have also enacted their local code brown response in order to deal with their local circumstances. Since the code brown was called, we have seen a drop in calls to 000 and also a reduction in presentations to the emergency department. And this has been really important in relieving some of the pressure on those frontline emergency services. We've also seen improvements in the number of staff available to work as a consequence of the changes to the furlough policy and improved access to rapid tests. The changes we've made to the streaming policy have also ensured there are more beds available across the system in which we could admit COVID positive patients if the need arises. Having said all of that, the pressure on the health system remains intense, and it's important to remember the challenges that our frontline staff are dealing with every day. And that's why announcements such as the new advertising campaign are so important. Finally, I would just like to emphasise that the best thing that we can all do to protect both the health system and our own health is to get vaccinated, and in particular, to come forward for your third or booster dose. Thank you.
Hi folks, the Minister has asked me to come and talk to you about my experience with COVID and the COVID positive pathways. In early Jan, I woke feeling a little unwell with a cough, a headache and a sore throat. We were lucky enough to have a rat in the house. I feel quite blessed. And I was a little shocked to find I had a positive result. I went on and registered that result onto the website, filled in the survey which included my symptoms and other health conditions. As a result of the survey, I was put on the COVID positive pathways health check, where I was given a health check survey at least once a day, sometimes twice a day, and I had a daily call from the COVID positive pathways team. They asked about my symptoms and any support I needed while I isolated. I knew they were really busy, but they were always very caring, gave me enough time to answer my questions, and they never rushed me, which made me feel like I was being supported. After a while, they became concerned with my breathing. They could hear the difficulty in my voice over the phone, and they sent me out a pulse oximeter to monitor over the phone, and they talked me through how to use it. Isolating with the rest of the family regularly, they regularly asked me if I needed any support in terms of getting groceries or any other medications and things like that. Importantly, I was asked if I was safe at home and if I could isolate safely. The folks at the COVID positive pathways are really, really busy, but they're doing a great job. And if you test positive on a RAT and register the result, it was very comforting knowing that somebody was monitoring my health, my illness and my well-being.
Thanks Tanya and Adam. Happy to take questions.
Why are we getting this campaign now and not 2 weeks ago when cases were at an all-time high? Was not a bit more effective then?
Well, the program has been going since October and has been regularly supported throughout that period of time in social media and other forums. We just felt now was the right time to take it to a new level because whilst things have stabilised, they've stabilised at quite a high level, and we would expect to see continued pressure on our health system for some time to come, and we think now's the appropriate time to kick this program off.
So are you simply advertising it now? It's just that it's been in place the entire time?
It has been in place for some time, but as we're seeing the sustained levels of pressure, and once school goes back, we would expect to see a bit of an uptick in cases. We just want to make sure that the community is aware and prepared, and more importantly, as we come to deal with how we coexist with COVID, that we all understand the different options should COVID come our way as to how to best deal with it in the COVID positive pathways at home program.
This time last week, James Molino said we were likely to see daily increases of 100 COVID hospitalisations a day, and that those could get to 2,500. Would you have a bit of an increase today that there are 95 fewer people in hospital now than there were this time last week, and we're still at just over 1,000? Is it fair to say things aren't as bad as the government was predicting when you announced the Code Brown, and if not, is that Code Brown timeframe that was outlined last week of 4 to 6 weeks still relevant?
So the time frame is still relevant. As Adam addressed, the program for Code Brown has brought a much stronger system-wide focus across our healthcare networks, not just in metropolitan Melbourne, but through large regional hospitals as well. It's focused both systems attention and community attention on just what is the appropriate step to take in these high levels of demand. And whilst we have seen things stabilise over the course of the last week, which is a good thing, it's stabilised at, historically speaking, extraordinarily high levels. And the notion that we're out of this is well and truly premature. Our health system continues to operate under extraordinarily trying circumstances. Our healthcare professionals, our entire healthcare staff are working under pressure like never before. The importance of this program for support at home is important to take pressure off that healthcare system, whilst at the same time empowering people with the confidence and support they need, that in most cases, overwhelmingly the majority of cases, that the support is there and that we can get you through that in the best environment for that care, which is at home.
Where are we at with staff absences? Has there been any improvement in that situation given cases have come down?
I'll get Adam, who's up to date on all those things on a day-to-day basis, but my understanding is it's the furloughing has certainly come off the peak that we saw a week or so ago. Adam?
Thank you, Minister. As I outlined before, we have seen a drop in the number of staff who are not available, either because they're now able to return to work under new furlough guidance, and we have increased supply of rapid antigen tests to support them to return, or simply staff have served their 7 days of isolation and are available to come back to work. But it's important just to emphasise we still have on any given day at the moment around 3,000 to 3,500 staff not available to come to work related to COVID, and that is still putting a significant strain on the health system and is likely to continue to do so over the coming weeks.
Adam, there were reports that 2,400 RAT kits have gone missing from the Austin hospital.
I'd have to take that on notice. Obviously, I'm the CEO of the Austin Hospital, Austin Health, and I'm not aware of any RAT kits going missing, but I'll take that on notice and we can come back to you.
What security arrangements are in place around RATs, given that they're a pretty pricey commodity at the moment?
Yeah, so obviously we always have security arrangements in place in the hospital. We've had security arrangements in place for the vaccines. Austin Hospital again has served as a distribution point for the vaccines across northeast Melbourne for the past year, and the rapid tests we treat similar to how we have the vaccines. Having said that, the rapid tests are there. They're available for us to be able to distribute to staff as required, but I'll take on notice the specific point you raise about the Austin today.
You mentioned that 000 calls and ED presentations have gone down since the code ran. Is that just a public education thing, and do you have any numbers to quantify the decrease?
I don't have the numbers here with me right now, but we do monitor this day by day and week by week, and we have seen a drop in attendances to emergency departments and calls to 000, as I said. We believe that's a response to the public message last week with the calling of the code brand, and we're very interested to understand if that will remain or be sustained over the coming days and weeks. As always, there's a balance to ensure that people do come forward and do attend ED or call 000 if they need that level of healthcare. So we're very conscious that the messaging needs to be that the public can still seek emergency and urgent care as and when they need to.
A lot of the key metrics seem to be going in the right direction. What do you have to see for these confidence of that code brown and I guess more broadly to pull down on elective surgery?
Sure. So in terms of the code brown, as we said last week, we estimated at the point of activation that it may need to be in place for 4 to 6 weeks, but that we would monitor that on a daily and weekly basis. So that's still our current position. And while the number of admissions and staff availability have either remained stable or improved slightly over the past 7 days, the system is still under enormous strain. And therefore we do think that the code brown settings is still the appropriate response at this point in time. In the background, we are preparing work to consider how and when we can restore elective surgery. We are very conscious of the impact that the deferral of elective surgery has on everyone on a waiting list, but we do not believe at this point in time that the system is in a position to restart elective surgery. Yeah, there's no doubt that over the course of the past 2 years we've had to defer a high volume of elective surgery and many other procedures as well, but we are confident that once we're at the point in terms of the pandemic response where we can focus again on elective surgery, that we'll be able to provide good access to care for those Victorians who need it. Obviously, we don't know exactly when that will be at the moment, but our commitment is to restart elective surgery as soon as we can.
Just on the stat about 0.071% of the 550,000 cases this year, only that amount has required hospital care. Obviously, that reads like a tiny figure, but the impacts are still huge, even though it is less than 1% of actual cases.
Yeah, that's correct. And that's been the message really, particularly during this fourth wave. The sheer volume of cases that we're seeing, even though only very few people, a small proportion, experience severe illness, that number is still large enough that it puts a great strain on our hospital services. The pure raw number means that we're still now seeing more patients admitted to hospital because they're COVID positive than we saw in wave 3, and certainly much higher than we saw in wave 2 back in 2020.
Does that figure reflect only the people who are admitted to hospital because of the severity of their COVID, or is it all the people who were admitted to hospital and happen to be COVID positive as well?
It will include both. It will be anyone admitted to hospital who's tested positive for COVID-19.
When will you look at winding back our rules given we've stabilised being at a high level, especially for things like masks with the return to the office again?
Well, we've seen masks play a really important role over the last 2 years now. They're low impact on people, but high impact on the virus. And we don't have any plans to change that. Indeed, as we've seen, there's a critical part of the return to school plan, their important role in the strong recommendation of working from home if you can, but coming to work only in the circumstances where you must. The importance of masks cannot be underestimated.
Last week, Professor Sutton said that the work from home would be assessed week by week. Is that still the case?
Indeed, almost on a day-by-day basis, the public health team go through all of the data and all of the public health measures, and as Adam indicated, whether it's elective surgery, whether it's other measures of the public health and social restrictions that are in place to keep us all safe, we want to make sure that we have the minimum restrictions in place, but the restrictions that are needed to continue as open as possible as we can be, Victorian community, as we continue to come forward in really strong numbers to get that third dose or the kids 5 to 11 vaccine.
Do you know when you next seek advice from the public health team on the set of restrictions?
If not daily, certainly every second day, we go through just what are the current restrictions in place, what are their needs, but formally we do that at least a couple of times a week.
Is the advice on at the moment for all those restrictions to stay?
I beg your pardon?
Is the advice you're getting at the moment for these to
Yes.
stay in place for December?
Yes. As you know, Victoria has the most transparent and accountable system of any jurisdiction, I would dare say, not just in Australia, if not the world, as to what the advice on public health matters is, and the tabling of those continues to occur on a regular basis, and I encourage you all to take the opportunity of reading Professor Sutton's advice as it becomes available.
Are you considering asking the ADF for more support so they're really going to able to do more of that?
So we're grateful for the support that the Commonwealth has provided for Ambulance Victoria, for support for, I think it's some 20 or so supports for drivers. That's 20 shifts that would otherwise not be filled every day. That helps. The Commonwealth continue to work with us in monitoring the situation, but we don't have any further announcements to add to that at this stage. It will be, in terms of languages, yes. Whether it's through the COVID Champions program that was so successful in 2021, the various WhatsApp groups, the digital supports, the targeting of working with community leaders, those language facilities are in place at the moment will continue to be rolled out in partnership with the Victorian Multicultural Commission, who I want to thank for their partnership, and the many multicultural community leaders who have worked with us. There's always more to do when it comes to engaging with all of our communities, but we have to make this information accessible and readily available to all Victorians, whatever their circumstances.
Would you be recommending to schools that they stagger their start times?
So we saw the staggering of start times in schools over the last year or so when schools were operating. These measures are designed by local school communities depending on the school's operation. They're designed to minimise the interactions, particularly of different age groups, which is part of the Department of Education's COVID safe plan that comes with a strong backing of the public health team. The common sense way in which that will be dealt with varies from school to school, community to community, and I know that those schools who are picking that up are in contact with their various families and communities about the best way to operate. It's a common sense, sensible measure that will allow schools to open and to stay open.
Some teenagers who are weeks away from turning 18, they've booked in their boosters before school starts. They've got the appointment and the away pharmacist or doctor for approval. Is that really necessary, and should we be making the most of the uptake?
And I think we saw a similar situation in the 11 to 12-year-old crossover group as well. We'll work through those systems with the Commonwealth and the online providers, but I'd encourage any 17-year-old to stick to it and make sure that, particularly as they get that second dose or indeed their third dose as they become eligible, it's what's going to get them out and about and safe. And if there's things that continually need to be ironed out in the system, I'm sure we'll continue to work through those issues as they become.
I realise that's not a good time to take leave in a 2-year pandemic, and I certainly don't doubt that you needed and deserved one. But given that we have been telling health workers that they can't take leave, was it ideal for you to be on leave during the peak of the Omicron wave?
The 9 days that I had off, which was the first 9 days in 2 years, having tried on 2 other occasions to take leave, which were cancelled on each occasion. I was nonetheless in regular daily contact with my department and other areas of government, and in a pandemic there's really no such thing as leave. But of course, with the looming Code Brown decision that was on the cards, I put in place arrangements once that decision was made to cancel the rest of my leave, and that's what I did. But my leave is inconsequential. The important workers in our healthcare system are the people at the front line. It is those doctors, nurses, paramedics, cleaners, security guards, physios, pathology teams, the thousands of people who are out there, the executive leaderships, the site managers who are working on stinking hot days like today in level 3 PPE to keep Victorians safe and responding to unprecedented levels of demand. They are the people who are at the front line. What ministers do, I'm sure we think ministers are important, but we pale into insignificance compared to the efforts of those frontline workers.
Are we at the beginning of the end of this pandemic, as someone said?
I wouldn't like to make that brave announcement. This pandemic is 2 years old today in regards to the first positive case that was diagnosed in Australia. It has continued to evolve in unexpected ways. I'd like to think that the worst of it is behind us, but I wouldn't be brave enough to make predictions as to how the virus will continue to evolve. We know that now, 2 years in, we have never been busier in our healthcare system. We continue to see tragic deaths. We continue to see very high levels of hospitalisation. We need to continue to respond to the pandemic, but predictions of its imminent demise I'll leave to others. So Australia Day is a national public holiday that's determined by the Commonwealth. Australians mark it, respect it, and celebrate it or mourn it in their different ways. And I would encourage all Australians to continue to do so, but whether it's changed or not is a matter for the Commonwealth.
How are we going with air purifiers in schools? Why was there a delay in getting?
Well, I refute the notion that there was a delay. The program has been progressively rolled out. There are thousands of cases of the air purifiers being delivered every day. The briefing that I received yesterday suggests that all of the hundreds of thousands of purifiers will be in place and ready to go as school opens. Yes, the program, like every other program, has been impacted by furloughing of staff through either the illness of COVID themselves or people being close contacts of carers, but measures have been put in place by the Education Department and their transport and courier supports and the hard-working staff at the schools, and I want to thank all of them. More air purifiers will be in Victorian schools than any other jurisdiction, and that is an important part of the COVID safe plan that the Education Department has put in place. Strong support from the Catholic Education Office and strong support from Independent Schools Victoria to make sure that the best way in which our kids can return to school from day one, term one, and stay at school is a part of that, and air purifiers are a significant part of that program.
There's still some school communities confused and wanting more information about the school plan. What do you say to those schools?
To which school communities?
There's some school communities requesting more information about the back to school plan.
Well, of course, the Department of Education is working through all of those issues with the state sector, both primary and secondary, and of course with the Catholic Education Office and Independent Schools Victoria for the independent and Catholic systems. I'd encourage any school community who believes that there's issues to get in contact with their relevant peak and make sure that as schools reopen, they do so in the best and safest possible way as per the COVID safe plans.
Can I just ask one finally out of left field, not in your domain? Do you think it's troubling that in tennis at the Australian Open, people aren't able to go and express a view about a human rights issue? I know you guys don't run or set the rules for tennis, but particularly as a former union leader who have attended protests and demonstrations, does that worry you?
So of course, as you rightly say, Paul, the issues around the Australian Open and what can or can't be displayed there is a matter for Tennis Australia. And in regards to the protests and campaigns for human rights, Australia is an open and democratic society, and of course, provided people protest and have their views heard in a peaceful and democratic way, that's something we all support. How that plays out at the Australian Open is particularly a matter for Tennis Australia.
But on the basis of that principle, that if things are done in a peaceful and non-offensive way, it would be, it's a democratic principle that they should probably be allowed to do that even at a private event, right?
So as people in a event such as the Australian Open, one that is strongly supported by the Victorian Government, there are arrangements in place as to what can and can't be done that are set by Tennis Australia. They're all there for the good management and sound running of, what's a significant event. But of course, how democratic protests and campaigns are run around human rights are an important part of a free, peaceful, democratic society. And provided that it can be done in an appropriate way, then of course I'm sure we'd all support it. Whether it's Peng Shui or any other human rights issue anywhere on the globe, I'm sure we all strongly support the notion that peaceful democratic protest is a part of our peaceful democratic traditions. Anything else?
Thanks, guys.
Thanks. Tanya's available if you want to speak to her. And thanks to Monique for another outstanding solo effort.
Hmm.